Okay. Okay. Right. Hello guys. Welcome back everyone. This is the third class in the series of pathology. Okay. Now, in the last two classes, we have started with the first chapter, that is the cellular injury. And in the cellular injury, what we have discussed about types of cell injury, reversible cell injury, irreversible cell injury. Also, we have discussed the types of cell death, that's necrosis, apoptosis, and also we have seen some special types of cell death, that's necroptosis, pyroptosis. And after that, we have seen some miscellaneous topics like intracellular accumulations. Now, before going to start with the next chapter, today we are going to mainly deal with the inflammation. Okay, before dealing with the inflammation, some leftover topics in the cellular injury, which I just don't want to leave them. So first, let's complete them in the first 15 minutes and let's begin with the chapter of inflammation. Okay, so after 15 minutes, we'll be beginning the chapter of the inflammation. First, let's complete the leftover topics in the cellular injury. So what are the leftover topics that we have to do in the cellular injury? The first thing is autophagy. Okay, so now we have to do some important topics about the autophagy, sir. So what exactly is autophagy? Autophagy means, see, auto means self, phagus, phagy means eating. So autophagy means self-eating. So when this will happen, sir? When this autophagy, what exactly this autophagy means? See, the destruction of our own organelles, destruction of our own proteins or organelles inside a cell. Now when it will happen? With aging. Okay, with aging, with cellular aging, now autophagy will occur. That's the one thing. And not only that, during severe malnutrition, okay, you are being severely, you are having severe malnutrition, you are not taking the proper nutrition. So what happens? Now you have to get the energy. So how you can get the energy is one way is by autophagy. Okay, I will explain in detail about how exactly autophagy can occur during severe malnutrition. Okay, see, let me give you an example. Now when you are having severe malnutrition, okay, what you are having severe malnutrition. Dekho, now during this condition, whatever the mitochondria we have, see, mitochondria, the inner mitochondrial membrane, the mitochondria is having lots and lots of important proteins which are involved in the oxidative phosphorylation. So mitochondria consist of lot of proteins, sir. Actually, in physiology also, I taught you, the inner mitochondrial membrane has highest concentration of proteins. Okay, in the cell, the inner mitochondrial membrane has the highest concentration of proteins. So now, we'll be using this mitochondria, we'll take this mitochondria, we'll break this mitochondria now. Okay, so by using these proteins, by breaking down of these proteins, we can at least generate the energy. So when this will happen? Not in normal states, in severe malnutrition, we are just breaking down our own mitochondria to generate the energy, sir. Okay, so there you go. So mitochondria, we are going to take the mitochondria, you are going to send it to the lysosomes. In the lysosomes, this mitochondria will be broken down and the energy will be released. So at least that can keep you survive in the conditions of severe malnutrition. Now, what you should know is the types of autophagy. How many types of autophagy are there, sir? See, there are mainly 4 types of autophagy which are called as a macroautophagy, microautophagy, mitophagy and chaperone mediated autophagy. There are 4 types of autophagy. Okay, we'll discuss one by one. Image based questions and some important points were there which you need to know. Macroautophagy. So what exactly is this macroautophagy? Macroautophagy means, dekho idhar. Here in this one single diagram I am trying to show you 3 different types of autophagy. Okay, dekho. These are the substances which are need to be degraded. By degradation of these substances, maybe those are proteins, misfolded proteins or something else. Now you are starting to degrade them. You have to degrade them. So where you have to degrade them? What is that organelle, the prime organelle involved in autophagy? The prime organelle, sir. It's a lysosome. So first you have to take them. You have to pack them. So whatever you want to break down, you have to pack them in the vesicle. So see, the isolation, see, now a membrane is going to form. Now a membrane is getting formed. Okay, around this vesicle, some membrane is getting formed and you formed a complete vesicle. So this complete vesicle, now it is called as autophagosome. Okay, autophagosome. Now this autophagosome is bringing all these materials which are need to be broken down. See, This autophagosome is fusing with what? It is fusing with the lysosome. This entire structure is the lysosome, sir. Okay, this is the lysosome. Now, autophagosomal formation occurred. Now, this autophagosome is bringing those substances which are need to be broken down, and this autophagosome is going to fuse with the lysosome. Okay, autophagosome is going to fuse with the lysosome, and in the lysosome, we have hydrolytic enzymes. Now, those hydrolytic enzymes will cause the breakdown of the substances, okay, and they will give you energy. This is one type. Okay, this is one type. The second type of autophagy, see, we have completed the macroautophagy. What exactly is macroautophagy? Macroautophagy condition mein there is formation of the autophagosome. Dekho, autophagosome is formed. Next type is called as microautophagy. Micro, okay, small substances. See, look here, microautophagy. What exactly is microautophagy? Microautophagy means small substances are directly engulfed, that directly entered into the lysosome for the process of degradation. Okay, for the process of degradation, see, there is no phagolysosome formation. Sorry, not phagolysosome. There is no autophagosomal formation. The vesicle is not getting formed. Okay, so these small molecules are directly uptaken. Okay, these small molecules are directly uptaken by the lysosome, and here they will be degraded. So, microautophagy is also completed. Next, what else we are having? See, we are having now chaperone. Okay, macroautophagy completed, microautophagy completed. I will talk about this mitophagy in a minute. I will talk about that in a minute. Now, let's discuss about the chaperone-mediated autophagy. Chaperone-mediated. So, what exactly are the chaperones? Chaperones are the proteins, chaperones like heat shock protein, HSP70, heat shock protein 70. See, chaperones are those proteins which help in the proper folding of the proteins. The chaperone molecules, I should say the chaperone molecules. See, these molecules, they will help in the proper folding of the proteins. Okay, normally, let's put it this way. In your ribosomes, proteins are getting synthesized. Okay, proteins are getting synthesized. Now, once the protein is synthesized, it need to be properly folded. And who will do that job for you? The proper folding of proteins is done by chaperones. Now, what if there is a misfolding? The protein is totally misfolded, sir, misfolded proteins. Now, these are not good. These misfolded proteins will accumulate in the body, leading to amyloidosis, a lot of stuff. Now, we need to degrade this misfolded protein. So, do you know what happens now? The chaperone molecule is going to take this misfolded protein, and now this misfolded protein is carried to the lysosome for the purpose of degradation. This is called as chaperone-mediated autophagy. Okay, chaperone-mediated autophagy. Dekho once, look here guys. See, in chaperone-mediated autophagy, look, here I am highlighting, this is the chaperone-mediated autophagy. Now, see, this is a protein. Okay, now this is a misfolded protein, sir, maybe. This is a misfolded protein. See, now these misfolded proteins, they are attached with what? The heat shock protein 70. Okay, heat shock proteins, HSP70. It's a chaperone. Now, these chaperone molecules, now they are going to enter into the lysosome. Now, for the entry here, you need to know there is some important molecule called as a LAMP2A. This LAMP2A, it's acting like a receptor. Okay, LAMP2A, it's acting like a receptor. Now, this heat shock proteins, they will come and bind with the LAMP2A, then this protein will be intaken. Okay, that protein will now enter into the lysosome. So, dekho, now at the end of the day, what happens? Now the protein, see, once it binds with the LAMP2A, now what happens? So, this protein, now it will enter, in the cell, the protein is getting degraded. That misfolded protein is getting degraded. So, this is what? This is chaperone-mediated autophagy. Okay, so now how many types of autophagy we have completed? Macroautophagy, microautophagy, and chaperone-mediated autophagy completed. Now the last fellow is mitophagy. So mito stands for what? Mitochondria. Phagy means what? Eating. So specifically the mitochondria are being targeted now. Okay, I said you, mitochondria have lots of proteins. Inner mitochondrial membrane have lots of proteins. So now the mitochondria are taken into the cell, are taken into the lysosome where they are getting degraded. Okay, now look here once, just summary kind of thing. Macroautophagy. In macroautophagy, autophagosomes are formed. True statement. In microautophagy, direct uptake of the cell organelles. Directly the molecules, directly the things are getting uptaken. Okay, cell organelles are getting uptaken into the lysosome. Now chaperone mediated autophagy. Now which molecules are involved? Heat shock protein 70. That's the chaperone. That's the chaperone is involved. And what is the receptor involved? LAMP2A. Okay. So this LAMP2A is present on the lysosomes. With the help of this LAMP2A, the proteins will enter into the cell and will be degraded. Okay. Now look here. Especially now what we are doing? We are degrading the lysosomes. Okay. See, around the, sorry, not the lysosomes, we are degrading the mitochondria. Okay, we are degrading the mitochondria. Now look here. This is the mitochondria. Now you are forming a vesicle around the mitochondria. Okay, so look, this is the mitochondria. Okay, mitochondria, sir. Now a vesicle is forming around the mitochondria. Okay, now see, you are forming a vesicle around the mitochondria. So that mitochondria is totally packed in a vesicle now. Now again, who is forming? A total vesicle, complete package, sir. So this is again autophagosome. Again autophagosome formed. But here the molecule, only molecule is the mitochondria. Now you know it. So this autolysosome. So this autolysosome, what exactly is autolysosome? You know it. It's the phagosome. This one, autophagosome, which is fused with the lysosome. Okay. So it's the autophagosome. This is the autophagosome. It is fused with the lysosome. Now what lysosome is going to do? Lysosome is going to release the hydrolytic enzymes. These hydrolytic enzymes now will start to degrade the mitochondria. The mitochondria are totally going to be broken down, and from there whatever the proteins are released, that will be used in the synthesis of energy, gluconeogenesis. We can go for that. Okay. So here what you need to follow for your exam, sir, in this mitophagy, this mitophagy is actually what? It's a type of macroautophagy. It's a type of macroautophagy. Why? Because who is getting formed? Autophagosome, a complete vesicle is getting formed. Okay. Now which molecules are involved? Some important points are, pink and park. Okay, pink and parkin. Okay, so these molecules plays an important role. Okay, pink and parkin molecules. I am not going in detail. Okay, in specific things are not needed. Pink and parkin molecules, they are involved in which type of autophagy? Mitophagy. Okay, that's the one thing which I want you to know. Okay, so pink and parkin, they are involved in mitophagy. And the marker, what is the marker of apoptosis? Annexin 5. Annexin 5 is the marker of apoptosis. And then what is the marker? The marker of autophagy. The marker of autophagy is LC3. Okay, so LC3 staining, it's a marker of autophagy. So with this, the autophagy topic is completed. What I want you to know is the types of autophagy: macroautophagy, microautophagy, mitophagy, chaperone mediated autophagy. Which molecules are involved in chaperone mediated autophagy? It is HSP70, heat shock protein 70, as well as LAMP2A. Pink and parkin are involved in mitophagy. Autophagosome, okay, this autophagosome is going to be formed. Autophagosome is formed in which conditions? It is formed in macroautophagy as well as mitophagy. Okay, so after this, the next topic which I want you to know is calcifications. Okay, sir, the topic of calcification, sir. This is also small topic, 5 minutes topic, which you need to know for your exams. See, in certain conditions, okay, calcium will start to deposit inside the tissues. Okay, it's also a topic which will come under the intracellular accumulations. Okay, now calcium deposition within the cells. How many types of calcification are there? How many types of calcification? The calcium deposition within the tissues. How many types of calcification? 2 types of calcification are there. What are they? One is dystrophic calcification. The other type of calcification is metastatic calcification. Dystrophic calcification, metastatic calcification. What is the difference between these two, dystrophic and metastatic calcification, sir? Dystrophic calcification means, first try to understand, my body levels of calcium, okay, my calcium levels are absolutely normal. My calcium levels in my serum are absolutely normal. But in dystrophic calcification, okay, in dystrophic calcification, the normal serum calcium levels are there. But in metastatic calcification, do you know what happens? The calcium levels in the body increases. The serum calcium level increases, sir. Now, then what is dystrophic and what is metastatic? What is the difference? In one type of calcification, the serum calcium levels are normal. In the other type of calcification, the serum calcium levels are elevated. More calcium is there. Now, let's talk about the dystrophic calcification. In which in which conditions dystrophic calcification will occur. Imagine there is some tissue destruction happening here. For example, there is some tissue destruction happening here, sir. Some tissue death or some necrosis is happening here. So in the areas of destruction, in the areas of damage, usually calcium will come and deposit. Okay, the calcium, if it is coming and getting deposited in the area of necrosis, in the area of destruction, in the area of tumors, so that type of calcification is called as a dystrophic calcification. Okay, the blood serum calcium levels are absolutely normal, but the calcium is getting deposited in those areas where there is destruction or damage. So that is called as a dystrophic calcification. Okay, and in metastatic calcification, what occurs? Metastatic calcification means the serum calcium levels are so high, so now the calcium start to deposit inside the tissues because of high levels of calcium. Now let's see examples. Sir, dystrophic calcification ka example, sir. Samoma bodies. What exactly are the samoma bodies? Dekho, now in certain types of cancers, okay, we'll discuss these in detail in the oncology also. Now in certain types of cancers, the calcium will start to deposit inside the cancerous cells. Okay, in the tumors, the calcium will start to deposit in the tumors. So these are the whorls of calcium. So these are the lamellated appearance or the whorls of calcium. These calcium depositions are called as samoma bodies. So what they will ask you in your exam is, samoma bodies are example of, okay, samoma bodies are example of dystrophic calcification. Okay, now itself let me tell you, okay, why again some other time. So the samoma bodies are seen in which tumors? Samoma bodies are seen in meningiomas. Okay, in this tumor conditions, meningiomas, serous cystadenoma of ovary. Okay, serous cystadenoma of ovary. Papillary carcinoma of salivary gland. Okay, papillary carcinoma of the salivary gland. Papillary carcinoma, thyroid gland. Okay, so these are some tumors, prolactinomas, glucoganomas, mesotheliomas. There are many other conditions are also there. For example, meningiomas, serous cystadenoma of the ovary, papillary carcinoma of the salivary gland, papillary carcinoma of the thyroid gland, prolactinomas, glucoganomas. In these conditions, calcium will start to deposit in the tumors. Now these calcium depositions, the whorls of calcium depositions, these are called as samoma bodies. And in TB, even in TB condition, that lymph nodes will be affected. Okay, there will be lymphadenopathy. Now in these lymph nodes, the calcium will start to come and deposit. So that's also an example of dystrophic calcification. And atheromas. Okay, you know the atherosclerotic plaques. Now even in this atherosclerotic plaques, in these areas of destruction, atherosclerotic plaque will be definitely, it's not a normal thing, right? It's a pathological thing. So here the pathological calcification will come and occur. Okay, pathologically the calcium will come and get deposited. So atheromas also, the calcium will come and get deposited even in atheromas. So that's also an example of dystrophic calcification. So give me some examples of dystrophic calcification. It's the samoma bodies, it's seen in the TB condition, and it is also seen in the atheromas. Samoma bodies are seen in which tumors? They are seen in meningiomas, mesotheliomas, serous cystadenoma of the ovary, papillary carcinoma of the thyroid gland, glucoganomas, prolactinomas. Okay. Now, after this, what else you should know? Metastatic calcification. Dekho. Metastatic calcification, sir. What exactly is metastatic calcification? The serum calcium levels are elevated, so much calcium is there. As the serum calcium level is more calcium is there in the blood. Now the calcium will start to go and deposit in the tissues. Okay. Now in which conditions you will see hypercalcemia? Which conditions can lead to hypercalcemia, sir? The conditions can like hyperparathyroidism. You know it. Parathyroid hormone increases the blood calcium levels. The calcium will go and start to deposit in the tissues. Simple metastatic calcification. Renal cell carcinoma. In renal cell carcinoma condition also, when we are discussing about the renal cell tumors, they will discuss. So in renal cell carcinoma also, okay, parathyroid hormone related peptide, parathyroid hormone like peptide is produced, okay, as a paraneoplastic syndromes. So in renal cell carcinoma also there will be hypercalcemia. Okay, blood levels of calcium will be more. Just remember that. Sarcoidosis. In sarcoidosis, calcium levels will be elevated in the blood. Okay, and even angiotensin converting enzyme levels are also elevated. That's one of the most important MCQ. Okay, in a condition called as sarcoidosis, where granulomas are going to form in different tissues. So in sarcoidosis, the serum calcium levels are elevated. True. And in multiple myeloma, there is a cancer, sir. This is a cancer, multiple myeloma. Okay, plasma cell dyscrasias. So even in this condition, the patients are going to have lytic bone lesions. The bones are going to be destroyed. So increases the blood levels of calcium. So simple thing. What I am trying to put into your mind is metastatic calcification means the blood levels of calcium are more. So calcium is getting deposited in the tissues. Which conditions? Hyperparathyroidism, sarcoidosis, multiple myeloma, renal cell carcinoma. These are the conditions. Even there are other conditions like milk alkali syndrome. Okay, milk alkali syndrome. There are even other conditions, sir. But these are what I want you to know. So first calcium, where it will deposit? The first place of calcium deposition in a cell, where first calcium will love to deposit? Mitochondria. Okay. So calcium deposits, right? Calcium first deposits where? In the mitochondria. Even we have discussed in irreversible cell injury, the topic of irreversible cell injury, I have said you, there is cell membrane damage, severe cell membrane damage. Calcium is going to come into the cell. This calcium will go and deposit where? The calcium will go and deposit in the mitochondria. The calcium will be deposited in the mitochondria. They are called as large amorphous flocculent densities, right? So what is the first site of calcium deposition? The first site of calcium deposition is mitochondria. But what is the exception? Exception is the kidneys. In kidneys, calcium first will go and deposit in the basement membrane. Okay, this is the one MCQ which will come in your exam. So what is the exception, sir? Calcium will love to bind in the basement membrane in the kidneys, but in other places calcium will love to go and bind with the mitochondria. Okay, done, sir. Now how to know whether calcium is there inside the cells or not? Okay, in the tissue, whether the calcium is getting accumulated or not. You want to stain, sir. You want to stain for the calcium. You have to do the stain for the calcium so that you can know whether the calcium is there or not. So what are the stains for the calcium? The stains for the calcium are MCQs. Again MCQs in your exam. Vancomycin. Okay, vancomycin is the stain for calcium. Alizarin red. Okay, alizarin red and calcine. So these are the three stains for the calcium. Vancomycin, alizarin red and calcium. So this is how. Okay, if you do vancomycin staining, this is how the calcium is going to look like. The calcium is going to take the black color. Okay, the calcium is going to stain in the black color, sir. And in alizarin red, the calcium will show the red color. Okay, in the name itself it's there, right? Alizarin red color. Calcium will take the red stain, and in vancomycin staining, the calcium, see, these are all the calcium deposits. So calcium is getting stained in black color. Okay, so with this, the first chapter, cell injury, is completed. Okay, the cell injury topic is completed, sir. Now let's begin with the new chapter, the real chapter, this today's chapter, sir. Okay, that's inflammation. Inflammation. Now I'm asking you, guys, could you please tell me? Okay, let me, from now onwards I will be reading your comments because I have completed the first chapter. Now I am just in a hurry to complete the first chapter. Now let's begin with the inflammation, sir. The chapter number 2, the inflammation. Come on, guys. Now I will be interactive from now onwards. Okay. So tell me, what exactly is inflammation? Okay, what exactly is inflammation, sir? Do you have any idea? Come on, guys. Fun mode. Aladita, Varun Kashyap. Good evening everyone. Now let's begin with the inflammation. Today we have to do the acute inflammation, sir, the vascular events and the cellular events. Very important chapter. Very important chapter. I will make sure I will discuss everything. Okay, I will discuss each and every MCQ. Okay, possible MCQs in your exam. Come on, fun mode. What exactly is inflammation? Can you tell me? First of all, see, inflammation. It ends with which word? For example, if I want to say there is inflammation in my heart. Okay, right? Inflammation. Inflammation in my heart. Okay, just give me 1 minute. I think there is some issue with this pen. It's misbehaving. Okay, let me take some other pen. Okay, so inflammation of my heart. One more, excellent, you are true. Okay, you are true. So inflammation to my heart, it's also misbehaving. So inflammation, it ends with, see, it ends with which word? Itis. Okay, anything which ends with itis is called as inflammation, sir. For example, inflammation in my heart is called as carditis. Okay, please excuse me, my handwriting is going to be a little annoying because the pen is not writing properly, so I will try to write it as simple as possible. Okay, I will try to write it as simple as possible, so please excuse me for that. Okay, so inflammation in the heart is called as carditis. Then what is the inflammation in the pancreas is called as pancreatitis. Inflammation in the spinal cord is called as a myelitis. Inflammation in the ovaries is called as a oophoreitis. So itis means what? Itis means inflammation. So first of all, why inflammation? So what exactly is inflammation? Inflammation, why inflammation means it's a response of your tissues. Okay, it's a response of your tissues. Okay, for example, I am teaching the class in a good way. For example, I will be having a good response from your side. If I am not teaching in a good way, I will be having from your side you will be giving a bad response, or you are not teaching properly, something kind of. Okay, so there will be a response if there is something like the Newton's the third law, right? For every action there is equal and opposite reaction. In the same way, whenever you injure a tissue, okay, whenever you injure a tissue, that tissue is going to give you the response. That response is called as the inflammation. Okay, okay. Now there is this one girl, beautiful girl. I just went to her and I just try to just irritate her. Okay, or for example, imagine I am a very good guy. I just try to deal with her in a very nice way. So how she is going to respond? She is going to respond in a good way. If I just try to misbehave with her, how she is going to respond? She is also going to give a weird look and she is going to definitely kick me, right? So in the same way, our tissues also when you injure them, they will also respond. That response of the tissue is called as inflammation, right? Response of injured tissues. The response of the injured tissues is called as the inflammation. Okay. Now, what are the cardinal signs? Now let's take the heading cardinal signs. Cardinal signs of inflammation. Now, come on quickly. So this should be high yielding. This should not be slow, gradually thing. No, this should be high yielding. This chapter should be high yielding. Okay, very fastly we have to complete it, and all the important topics we have to complete it. So what are the cardinal signs of inflammation? See, imagine there is some tissue injury over here. So whenever there is injury over here, definitely this injured tissue will show the inflammation. So what are the cardinal signs that you will see? There are 5 cardinal signs, sir. In the area of inflammation, you will see 5 cardinal signs. What are they? So these 5 cardinal signs are Dala, 1, Dala, Kela, tumor. Okay, Dollar, any doubts? If you are having any doubts, you can all the time ask me in the chat session. Okay, so Ruber, yes, one more, you are true. Ruber, tumor, Kala, Dollar, yes, functional Asia. Okay, so what are they? Dollar, Kala, tumor, Ruber, functional Asia. Now tell me, what exactly is dollar, sir? In this area of inflammation, here is the area of inflammation, sir. Now, this area you are going to have dollar. What exactly is dollar mean? Dollar means pain. Okay, what exactly is calor? Calor means increased temperature. What is tumor for mode? Tumor. Tumor means in the area of inflammation you are going to have swelling. Okay. What is rubor? In the area of inflammation you are going to have redness. And what is functional Asia? Now, wherever there is inflammation, for example, inflammation in my joints or inflammation in my muscles, wherever there is inflammation, definitely that organ function or that function, the function of that particular tissue is going to be compromised. So, decrease activity, decrease function. Decrease activity or decrease function of that particular tissue. So, these are the 5 cardinal signs of the inflammation. Okay. Whenever you are having inflammation, that tissue is going to show these 5 cardinal signs. Okay. Now out of these 5 cardinal signs, the first 4 cardinal signs is given by, do you know the first 4 cardinal signs? Okay, the first 4 cardinal signs, sir, are given by a separate person, and the 5th cardinal sign is given by separate person. Okay, do you know? Do you have any idea fun mode? Fun mode, Varun Kashyap. Yes, fun mode, excellent. So the first 4 cardinal signs are given by Celsus. And the 5th cardinal sign, functional ASIA, is given by? Who gave the functional ASIA? Rudolf Virchow. Okay, Rudolf Virchow. Now, this guy, Rudolf Virchow, is the father, sir. He's the father of important points about the Rudolf Virchow, which we should know for our exams. He's the father. Okay? He's the father of what? He's the father of modern pathology. He's the father of modern pathology. And not only that, he's also the father of, he's not the father, he's the one who coined the term cellular pathology. Okay, so Rudolf Virchow is the father of modern pathology. He gave the 5th cardinal sign, sir. He gave the 5th cardinal sign, that's the functional ASIA, and the other cardinal signs, the Dala, Kala, Ruber, the tumor, were given by Celsus. Now, some important points which you should know for your exams regarding the Rudolf Virchow. Okay, sir, have you ever heard about Virchow triad? Virchow triad. Do you have any idea about the Virchow triad? Sir, I'm getting a little deviated from the topic, a little deviated, sir, because this is very important. Okay, I should integrate this here itself. Now, Virchow triad. Do you have any idea functional ASIA? Fun mode, sorry. Virchow triad. See, Virchow triad includes endothelial injury, endothelial injury. Next, alteration in blood flow. Alteration in blood flow and hypercoagulability. Okay, hypercoagulability. So what exactly is this Virchow triad talking about? So what this Virchow triad, sir, what exactly is this? Sir, Virchow triad is named after Rudolf Virchow, the father of the modern pathology. Sir, in this Virchow triad, the patient is going to have, the person, see, I should say something like that. If a patient is having any of this, okay, if the patient is having any of this, like endothelial injury or alterations in the blood flow, what is the normal blood flow? Normal blood flow is in like streamlined fashion, laminar fashion. It's a streamlined blood flow, sir. Our blood in the blood vessels is going in a very streamlined fashion. Alteration in the blood flow means stasis, okay, sluggish flow of blood, or turbulence, okay, turbulent blood flow. So in these conditions, in these alterations like stasis and turbulent blood flow and hypercoagulable state, in hypercoagulable state, do you know what happens? So this Virchow triad is telling you when you will have thrombosis, when you will form the intravascular clots, okay, unnecessarily. Why intravascular clots will be formed? This will be explained by this Virchow triad. Okay, so Virchow triad includes endothelial injury, alterations in blood flow and hypercoagulable states. Now in this particular condition, see, these things happens in your body, that will lead to thrombosis. Okay, these conditions can lead to thrombosis. You know, right, the deep venous thrombosis kind of. Okay, so we are just trying to integrate the things. Rudolf Virchow is the father of the modern pathology. He gave the term cellular pathology, and Virchow triad also completed. So why we are discussing about all this? Because the functional ASIA, the last cardinal sign, the functional ASIA, which is the decrease in activity and the decrease in function, is given by our Rudolf Virchow. Now after this, what else you should know? There is something called as Virchow node. Okay, Virchow node. So guys, can you tell me what exactly is Virchow node? Virchow node. So Virchow node is left side supraclavicular. It's a left side supraclavicular lymph node. Okay, which is affected. See, this left side supraclavicular lymph node, it will be affected in a condition, sir. See, that's a gastric carcinoma. Gastric means stomach cancer, sir. Gastric carcinoma. So this gastric carcinoma, it metastasizes. Okay, this gastric carcinoma, where it will metastasize? From the stomach, this gastric carcinoma, it will metastasize to the supraclavicular lymph node. Now the supraclavicular lymph node is called as a Virchow node. Okay, so now tell me, Virchow nodes are seen in which cancers? In the gastric carcinomas. Okay, so important points about the Virchow are enough. Rudolf Virchow, thank for him being the father of the modern pathology. Now let's come back to our topic, inflammation, sir. Okay, so inflammation, I gave you the definition. It's a response of the tissues towards the injury. 5 cardinal signs of inflammation I have discussed. Now, types of inflammation. Tell me, types of inflammation. How many types of inflammation do you know? Kashyap, one more. How many types of inflammation do you know? Come on, guys. I hope you guys are brilliant. How many types? 2 types. They are what? Acute inflammation and chronic. Okay, there are 2 types of inflammation, acute inflammation and chronic inflammation. Okay, yes, one more, acute inflammation and chronic inflammation. So acute inflammation, see, there is nothing cute about it. Okay, acute is not really cute, sir. So most of the students fail to understand what is the difference between acute and chronic inflammation. Okay, so it's a little confusing, sir, but very simple. Acute inflammation means, for example, right now, okay, I just took a pin, or I just took for example, some hot object, fire. Imagine I just keep my finger in the fire, sir, So I am damaging my tissue or not? Yes, I am going to damage my tissue. So immediately within the next 1 minute, 1-2 minutes, immediately here inflammation will start. So inflammation is going to start just like that, sir. Just like that inflammation is starting. So this type of inflammation is going to call as acute inflammation. Simple, right? If I just go and put my finger in the hot object and the fire, immediately it's going to burn my tissues. Immediately inflammation is going to start. Fluid will start to accumulate over that area. Inflammation will start. Or do you think if I put my finger in the fire, tomorrow inflammation will start? No. Immediately it will start. So acute inflammation starts rapidly. Okay. So begins in short time. Okay, it begins in short time. And so today I had some burn injury over here, small burn injury over here. So what will happen? It's going to heal, right? It's going to be there for 1 year. No, it's not going to be there for 1 year. It's going to heal in maybe maximum 3-4 days or 1 week maximum. So ends quickly, sir. Begins in a short time, begins immediately and ends also quickly. Ends quickly. Okay. So these are acute inflammations. Acute inflammation means begins quickly, ends quickly. That's it. Story is closed. Then what are chronic inflammation, sir? Chronic inflammation means what? Imagine I am the person. Okay. Or imagine there is this one female who is suffering with rheumatoid arthritis. Sir, rheumatoid arthritis. Rheumatoid arthritis is going to be there for one single day, 2 days, for 1 week. No. Rheumatoid arthritis means inflammation of the joints for continuous period of time. For 10 years, 20 years, she is still suffering with the inflammation in the joints. So inflammation that is prolonged, long-lived. Okay. So if the inflammation is seen for long period of times, then it is called as a chronic inflammation. Seen in chronic disorders, sir, like, right, chronic inflammation seen in chronic diseases, like autoimmune diseases. Okay, autoimmune diseases like rheumatoid arthritis can be seen in conditions like SLE, okay, or can be seen in conditions like cancers. Okay, so these are the inflammatory conditions which are going to be seen for a long time. Okay, so now completed, sir. Types of inflammation, how many types? Acute inflammation, chronic inflammation. Acute inflammation short time, chronic inflammation long time. Now after this, one more, what else we have to know? One more, what else we have to know about the inflammation? Acute inflammation, sir. Can you tell me what is the important point about the acute inflammation? Pankaj, you are asking some question? Yeah, I will discuss about that. Okay, all that important MCQs, all that single liner questions, whatever will come, I will ask that. Okay, next. Same, acute inflammation, right? Acute inflammation. What is the difference between acute and chronic? Okay, sir, acute inflammation and chronic inflammation, what are the differences? One thing, see, if I am having acute inflammation, right now I am having acute inflammation, do you know what is the major cell, what is the most important cell involved in this process? MCQ, sir, very important FMG MCQ as well as a PG MCQ. The cell which is involved in acute inflammation is neutrophil. Okay, so neutrophils are the cells mediate the acute inflammation. Then can you tell what is the most important cell in the chronic inflammation? Chronic inflammation, long time, the inflammation is continued by which cells? Macrophages. So macrophages are involved in chronic inflammation. Sir, now here some exceptions. I will tell you one exception. So normally in acute inflammation, neutrophils are involved, but this one acute inflammation which is called as typhoid. So what is typhoid? Typhoid is also called as enteric fever. Okay, can you tell me this enteric fever is because of which organism? Typhoid or enteric fever is because of? Typhoid or enteric fever is because of? Rini, fun mode, Pankaj. Typhoid or enteric fever is because of which organism? Salmonella typhi. Okay, now just tell me one thing. Typhoid, is it an acute problem or chronic problem? Is it going to be there for 6 months? No. The typhoid is very short-lived thing, right? Maybe for 1 week or 10 days, that's it. Okay, it will be cured. If you use the tablets, it will be cured. Okay. So, here in this type of acute inflammation, normally neutrophils should be the prominent cells, dominant cells, but here lymphocytes are going to be the dominant cells. In this acute inflammation because of the salmonella, lymphocytes are going to be predominant. Lymphocytes are the prominent cells, and that's your MCQ. And normally in chronic inflammation, who is the predominant cell? It's the macrophage. But there is this one chronic inflammation, right? Chronic pseudomonal infections. Pseudomonal infections. In chronic pseudomonal infections, see, in the name chronic is there, chronic inflammations. In this chronic pseudomonal infections, what is the dominant cell? It's a neutrophil again. Neutrophil, not the macrophage, but the neutrophil. So this is the exception. These are the exceptions. Typhoid is one exception. That Salmonella typhi. In Salmonella typhi infections, lymphocytes are going to be predominant. And in chronic pseudomonal infections, Pseudomonas, don't forget, important points are there regarding Pseudomonas. Can you tell me some important infections because of Pseudomonas? Pseudomonas. You can answer that in the chat session, but Pseudomonal infections is going to have dominant number of neutrophils, not the macrophages. Come on, fun mode. Can you tell me? Pseudomonas. Fun mode, Pankaj, Varun Kashyap, Reen. Guys, can you tell me? We will come to that. Pankaj will come to that. What is the vasoconstriction or vasodilation? I will come to that. I will come to that area. Okay. Just wait. Pankaj, just wait. I will discuss about that. Okay. Pseudomonas, important for your FMG exam as well as the NEET PG exam. Okay. And board exams. See, Pseudomonas is associated with burn wounds infection. If I am having burns, that burn wounds will be infected with Pseudomonas. Okay. Pseudomonas, other important things are like jacuzzi syndrome, hot tub folliculitis. Okay, jacuzzis, you know, right? The jacuzzis, like, you know, that those hot tubs where you will go and sit. Okay, in the vacations. So in that it will cause hot tub folliculitis. And in those hot tubs, this will be there. Okay, Pseudomonas will be there. Okay, remember that. Now, shall we begin with the acute inflammation? Now, let's begin with the topic, sir. Acute inflammation. Okay. Acute inflammation. Again, I am telling sorry for my handwriting. The pen is misbehaving. So I should write in a very easy way. Okay. If I am touching my hand to the screen, the lines are coming. Okay. So acute inflammation. Let's see the events. What are the events? Okay. What are the events seen in acute inflammation? Two events are there. Okay. There are two events. First events are vascular events. And the second events are cellular events. Okay, vascular events are there, cellular events are there, which means, imagine there is some tissue injury. Now the tissue got injured. Now whenever there is a tissue injury, now here inflammation starts. Acute inflammation, I am talking about the acute inflammation. Now acute inflammation starts. Now in this acute inflammation, there are two events. First, there are two events will occur, okay, one by one. First, vascular events will occur. Some vascular changes will occur, sir. Some vascular changes will occur, followed by cellular events. Vascular events followed by cellular events. Now, let's begin our topic with vascular events. Okay, what are the vascular events that's seen in the acute inflammation? Okay, vascular events, what are those vascular events? Now, first vascular event is whenever there is some damage. For example, imagine you just get a blade and you just make a cut over here. Okay, just give me a cut. Now, tissues are getting damaged, no doubt. Tissues are getting injured. Now, do you know what's the first thing that will happen in inflammation? What is the first vascular event that will happen is vasoconstriction, sir. So, the first blood vessels will undergo vasoconstriction. Just for a second, they will undergo vasoconstriction, sir. This is a transient thing. This is a transient response because of the neurogenic reflex. First, to prevent the blood loss, immediately the blood vessels will undergo constriction. So, first vasoconstriction. Pankaj, I hope now you understood. The first vascular event is vasoconstriction. Okay? And it is transient. It's like a transient thing. Okay? Now, second event is vasodilation. Okay, vasodilation. Now, why vasodilation? Sir, imagine there is an injury. Okay, there is some infection going on or some injury happens here. Now, what happened to the blood vessels surrounding this area? The blood vessels surrounding this area will start to undergo vasodilation. Why vasodilation? To bring the more blood, to bring the more plasma, so that more glucose will come, more neutrophils will come, more RBC will come. Okay, so more neutrophils, more macrophages, more complement proteins will come, so that if there is any bacteria in this area, if the bacteria is causing this injury, the bacteria will be killed. Okay, so first vasodilation is first vasoconstriction occurred, followed by vasodilation. Vasodilation brings more blood flow to that area. Okay, more blood flow is coming to that area. Okay, so vasodilation. Okay, some important points about the vasodilation here itself. Vasodilation, what it is doing? It increases the blood flow. Okay. Now, because of this vasodilation, tell me, more blood is coming to that area, right? Into the area of inflammation. So, if more blood is coming to that area, how that area will look? It's a rubber. Okay. So, vasodilation is the one responsible for redness, rubber. Again, if more blood is coming to this area, so what happened to the local temperature in this area? More warm blood is coming. Okay. So, causes calor. Calor means what? Increased temperature. So, MCQ asked in the exam is, rubber and calor are because of vasoconstriction, vasodilation, increased vascular permeability or stasis? They will give you. So, rubber and calor, they are because of the vasodilation. Vasodilation, is it good or bad? Vasodilation is good. It's bringing more blood, more WBCs are coming, more neutrophils, more macrophages, more neutrophils are coming, so that if there is any bacteria, that bacteria will be killed. Okay. Next, sir. Next, what else they can ask you in your exam is, what are the mediators? What are the mediators that are causing this vasodilation? This vasodilation is mainly because of what? Okay. So, this vasodilation, someone should mediate, right? So, sir, here there is tissue injury. Here the tissue is injured. Now, from this injured area, some mediators are released. So, some chemical mediators are released. Those chemical mediators are causing the vasodilation. Who are those mediators? Now, mediators. It's histamine. MCQ. Sir, histamine is produced by which cells? Sir, histamine is released from? Sir, histamine. M-I-N-E. This is histamine. Histamine is released from which cells? Mast cells, sir. MCQ. Histamine is released from mast cells. Okay, so histamine is causing the vasodilation. Because of vasodilation, more blood flow. Because of more blood flow, there is rubber and calor. Next, third. So, vasoconstriction completed, vasodilation also completed. After that, what? Okay. So, after that, there is increased vascular permeability. Okay, increase vascular permeability, sir. So what is increased vascular permeability? Vasodilation increases the blood flow. Okay. Now try to understand like this. Imagine this is your blood vessel. Okay. Now this is your blood vessel. So this is the tissue. This is the tissue where inflammation is going on. Okay, this is the tissue where inflammation is going on. Now, do you know what happens now? See, the plasma, now from this blood vessel, it will start to leak. Now this plasma, now it will start to leak into the tissue, sir. So, now the blood vessels become more leaky. Now the blood vessels become more permeable for the plasma to enter into the tissues. That's something good. More plasma is coming. More complement proteins will come. So this complement activation can actually kill the bacteria. If there is any bacteria in that inflamed area, that will be killed. Okay. So increased vascular permeability is the third vascular event. Third vascular event. But the hallmark of the acute inflammation is increased vascular permeability, right? So this increased vascular permeability, MCQ, is a hallmark of acute inflammation. Okay, it's a hallmark of acute inflammation. Now my question to you is, sir, what are the mechanisms? How actually this increased permeability works? Why exactly more plasma is coming into the tissues? How, sir? How exactly is? Let me write here the mechanisms. The mechanisms of increased vascular permeability. Okay, the mechanisms of increased vascular permeability. Dekho, before telling you the mechanisms, I just want to add one more point here. See, rubor and collar are because of what? Can you tell me? So this rubor and collar, are they because of vasoconstriction or vasodilation? They are because of the vasodilation. More blood is coming. Now, what I explained you, sir, because of the increased vascular permeability, more fluid, more plasma is coming into the inflamed area. So when more plasma is leaking into the tissues, that tissue will become swollen. So because of this increase in vascular permeability, which cardinal sign is seen? It is the tumor, sir. So tumor. So tumor is due to increased vascular permeability. Okay, sir. Now what are the mechanisms? Why vascular permeability, sir? How vascular permeability, not why, how vascular permeability is, first thing is endothelial cell contraction. Okay. Endothelial cell contraction. Okay, endothelial cell contraction. So first let me explain you what exactly is the endothelial cell contraction. Okay. Now imagine this is your blood vessel. Okay. Normally blood vessel is lined by which cells? Endothelial cells. Endothelial cells. Okay. Now what is happening is, normally this is how the endothelial cells are. For example, see, these are the endothelial cells. Normal endothelial cells. Now in this inflammation, what happens is, because of certain mediators which are coming from the inflamed area, because of these mediators, now see, what is happening to the endothelial cells? So the endothelial cells are contracting. The endothelial cells are getting contracted. When the endothelial cells are getting contracted, what happened to the space now? So now there is this extra space, sir. Now through these gaps, now fluid is entering into the tissue. Okay. Now the endothelial cell contraction is the most common mechanism. Okay, this is the most common mechanism of increased vascular permeability, where the endothelial cells are getting contracted, creating the gaps through which the plasma is leaking into the tissue, inflamed area. This is one thing. Next, what are the mediators? Mediators for this endothelial cell contraction. Why the endothelial cells are getting contracted, sir? What are the mediators? The mediators, sir, let me write here. Mediators in this is histamine again, histamine and serotonin. Okay, so because of this histamine and serotonin, the endothelial cells will undergo contraction. Okay, next, so this is one mechanism, number one, endothelial cell contraction. Fun mode, can you tell me what is the second mechanism? Any other mechanisms, do you know? Fun mode? First mechanism is this. Second mechanism is leukocyte. leukocyte mediated injury. Okay, so direct leukocyte mediated injury cell. Okay, leukocyte mediated injury. So what exactly is this leukocyte mediated injury? Okay, now look here, the third one I am explaining here. See, देखो in this image. So this is your blood vessel. Okay, this is your blood vessel, and here is your tissue, inflamed tissue. Okay, this is the inflamed tissue, sir. Now what happens is, whenever there is inflammation, okay, whenever there is inflammation, more blood is coming, vasodilation, more blood is coming, more neutrophils are coming. See, now these are your endothelial cells. Imagine these are your endothelial cells. Now neutrophils are coming to this area. Okay, these are the neutrophils. Okay, this is a neutrophil. Imagine this is your neutrophil. Now this neutrophil, what it will do is, now in this inflammatory condition, now this neutrophils, it will release a lot of cytokines. Okay, now directly this neutrophils can lead to damage of this endothelial cells. Okay, these endothelial cells might be damaged because of the neutrophils. When these endothelial cells are damaged, what happens? See, now देखो, this endothelial cell is getting damaged because of a neutrophil. Okay, now what happens? See, here the endothelial cell is damaged. Now when the endothelial cell is damaged, what happens? Now the fluid through that space, the plasma can leak into the tissue. So this is called as leukocyte mediated injury. Okay, and third mechanism of increased vascular permeability. Sir, can you tell me any other reason why more fluid is going into the tissues? One example I gave you, endothelial cell contraction, most common. Leukocyte mediated injury. Next thing is, see, whenever there is injury over here, whenever there is some trauma, okay, so there is some trauma, not only tissue is damaged, but endothelial cells are also damaged, right? Endothelial cells, blood vessels and endothelial cells inside the blood vessels, they can be directly damaged. So that is called as a direct endothelial injury. Okay, so direct damage to endothelial cells. So now tell me, what are the reasons for increased vascular permeability? The reasons for the increased vascular permeability is, first one, endothelial cell contraction, leukocyte mediated injury to the endothelial cells. Third one is a direct damage to the endothelial cells, direct damage because of the trauma. Some endothelial cells are damaged, so blood vessels become more leaky. Okay, more fluid is now coming to the tissues. Now fourth reason is the transcytosis. Okay, the reason number 4 is transcytosis. Now what exactly is transcytosis? Now let me explain here itself. Now imagine this is the blood vessel. Now what are these? These are the endothelial cells. Okay, now imagine I am just showing you the intact endothelial cells. There is no damage to the endothelial cells, and I haven't even shown the endothelial cell contractions. Okay. Now here what is this? This is the tissue which is getting inflamed. Okay, this is the tissue cell. Imagine this is tissue. Now what happens is, in the state of inflammation, there are certain mediators that are produced. Okay, there are certain mediators that are produced. I will tell you what is that mediator. Now these mediators will start to act on this endothelial cells. During inflammation, from the damaged area, from the inflamed area, these mediators are getting produced. These mediators, they will act on the endothelial cells. So now endothelial cells, what they are doing is, they are going to make this organelle. This organelle is called as the vascular organelle. Okay, so this organelle, VV organelle, vascular organelle. So through this organelle, okay, through this organelle, what happens? Now fluid is directly, transcytosis means what? Trans means through the cells, directly through the cells. Okay, so directly through the cells, now the fluid is going into the tissue. Okay, so now what are the mediators? So this is the vascular organelle I explained you. So which mediators will help in production of this vascular organelle and helps in transcytosis is vascular endothelial growth factor. So vascular endothelial growth factor, whatever is produced, okay, vascular VEGF, vascular endothelial growth factor that's produced, what it is going to do? It's going to help in transcytosis. Transcytosis means through the cell, the fluid is going to enter into the tissues. So these are some mechanisms of increased vascular permeability. This is the most important topic. Increased vascular permeability is the most important topic. So now tell me what happened? Whenever there is some injury happening in the tissue, first vascular events will occur. What is the first vascular event? Vasoconstriction. What is the second vascular event? Vasodilation. What is the third vascular event? Increased vascular permeability, increased vascular leakage. Leakage, the blood vessels are become leaky. Now what are the mechanisms of this increased vascular permeability? One is endothelial cell contraction, leukocyte mediated damage to the endothelial cells, or direct damage to the endothelial cells, or transcytosis, the fluid shift, the fluid movement through this vascular organelle because of this vascular endothelial growth factor. Okay, this vascular endothelial growth factor, it acts on the endothelial cells, so transcytosis will occur. 4 mechanisms I said you. Okay, and one more mechanism is there, 5th mechanism, final mechanism, that is angiogenesis. Okay, angiogenesis, sir. So what exactly is this angiogenesis? Angio means blood vessel, genesis means newly produced. Okay, newly the blood vessels are getting produced. Now try to understand, imagine there is this area of inflammation, sir. Here inflammation is going on. Okay, this is the area of inflammation. Now, do you know what happens from this damaged area? Just now I explained you, from this damaged area, vascular endothelial growth factor is released. Okay, who is producing this vascular endothelial growth factor? We will discuss about that later. But from the damaged area, this vascular endothelial growth factor is getting released. Now this vascular endothelial growth factor, do you know what it will do? It will help in the angiogenesis. Now because of this vascular endothelial growth factor, new blood vessels will start to come to this area. Okay, new blood vessels will start to come to this area, sir. Now tell me, new blood vessels are immature blood vessels. They are not tight. Okay, so they are immature blood vessels, sir. Between the endothelial cells, proper tight junctions are not there. Now these blood vessels are very immature. They are leaky. Okay, so because of this angiogenesis, immature blood vessels are forming. These immature blood vessels are more leaky blood vessels, sir. They do not have tight connections between the cell. They are more leaky, so that more and more fluid is coming into the tissues because of the angiogenesis. And your exam MCQ is, the angiogenesis is because of which mediator? Vascular endothelial growth factor. Okay, so with this done, sir. With this done, the increased vascular permeability is completed. What are the mechanisms? Endothelial cell contraction, leukocyte mediated damage, direct damage to the endothelial cells, and transcytosis, as well as angiogenesis. Okay, yeah, neovascularization, Pankaj. Yeah, neovascularization is the angiogenesis. Because of which? Because of what? Because of vascular endothelial growth factor. Okay, so these are the vascular events. 3 vascular events are completed. So what is the first vascular event? Vasoconstriction, that is transient. Vasodilation, increased vascular permeability. Now, the last vascular event which I want you to know here is, right, the last vascular event, the 4th vascular event, the big one is, anyone? Any idea? Stasis. So stasis will occur, sir. Stasis. What is stasis? Slow blood flow. Blood is going slowly. Okay, blood is going slowly. Why blood is going slowly? Now try to understand like this. This is the blood vessel. Okay. Now what is this? This is the area of the tissue which is getting inflamed. This is the tissue which is getting inflamed. This is a sad thing. Okay, it's a sad tissue. It's getting inflamed, sir. Okay. Now what I said you, sir, the endothelial cell contraction. Endothelial cells will contract. Okay, endothelial cells will contract. Now fluid is going to shift into the tissues. Fluid is shifting into the tissues. See, when you are removing the fluid, okay, when you are moving the fluid out of the blood vessels, see, the fluid is coming out. So what happened to the blood now? The blood is becoming thicker, right? The viscosity of the blood increases. The concentration of the blood increases. So now, do you think blood will move fast? No. The fluid is shifting, so the movement of the blood, so the blood is getting concentrated. Okay? The blood is getting concentrated, sir. Okay? So concentration increases. Why? Why? Because there is shift of the fluid. The fluid is getting shifted. Now the blood is getting concentrated. So this concentrated blood, now it will go slowly through the tissue. Slowly through the tissue. Why? This is good, sir. This is good. Because when the velocity of the blood decreases, now from the blood, the cells, neutrophils, macrophages, they get enough time. To leak into the tissues. They will also come into the tissues, sir. The blood is going slowly As the blood is going slowly, now it is easy for the macrophages and neutrophils to come into the tissue. So that's the last vascular event. So come on guys, tell me how many vascular events we have discussed? We have discussed 4 vascular events. Okay, 4 vascular events. What are they? One is vasoconstriction. The second thing is vasodilation. Vasoconstriction, vasodilation. Increased vascular permeability and its mechanisms. And the last vascular event is stasis. Okay, with the stasis, vascular events are completed, sir. First vascular events completed. Now, what will happen now? Cellular events. So vessel changes are completed. Vessel changes when the tissue is damaged. Now, what are the vessel changes that will happen? Discussed. Done. Now, let's take the heading. The next thing, half of the thing is completed, sir. Now, from here it is easy. Cellular events. Cellular events. Okay. So, what are the cellular events? Sir, which cells? First of all, you are saying, sir, cellular events. Which cells? Neutrophils, macrophages. So, these phagocytic cells. Okay. Now, do you know what happened during the inflammation? Now, let me show, sir. First event, number 1, first event is called as margination. So, what the hell is this margination, sir? Margination means, dekho, now this is the blood vessel. Okay, this is the blood vessel. Fun mode, this is the blood vessel. Okay, Pankaj, fun mode. Okay, this is the blood vessel, sir. Now, what is this? This is the area of inflammation. Okay, this is the inflamed tissue. Now, dekho, yes, fun mode. Yes, yes, you are true. Okay, margination means normally, see, in our blood vessel, blood is going in very laminar fashion or streamlined fashion. Blood is going in streamlined fashion. In the center of the blood vessel, what are these cells? These are your RBCs. Surrounding the RBCs, what are there? Sir, WBCs are there. Okay, WBCs are surrounding the RBC. Now, what we need to do? Sir, here is the area of inflammation. Now, this WBC, that's a neutrophil, it have to come towards the wall. It have to move towards the endothelial cells. First, it have to move towards the endothelial cells so that now it can enter into the tissues. First event is, sir, this WBCs need to come to the margins of the blood vessels. Okay, they are in the central column. They are going in the central column. Now these cells need to be marginated. So this is called as margination. Okay, so margination means what? The movement of the WBC, towards the margin, towards the blood vessel wall. This is called as margin. Towards the periphery. Exactly, towards the periphery. Okay, that's called as a margination, sir. Okay. Now after margination, what is the second cellular event? Okay, it came to the margin, sir. The second cellular event is called as rolling. So what exactly is this rolling? Rolling means, I will tell you, say, with an example I will tell you, dekho, now again this is the blood vessel. Okay, this is the blood vessel, right? So these blood vessels are lined by what? So these blood vessels, they are lined by this endothelial cells. Okay, I am showing the endothelial cells with contraction. Endothelial cells are contracted. Okay, clearly I am showing the gaps also. Now, this is the area of the tissue. Okay, now let's take this is the area of the tissue, sir, where inflammation is going on. Okay, now here, so what are these? See, for example, see what is this? This is not the sperm, this is the bacteria. Okay, this is the bacteria, sir. Okay, bacteria is there, it's causing, so this bad guy is there. Okay, he's causing the inflammation. Okay, maybe the inflammation in this case maybe because of bacteria or some because of autoimmune disease or because of some immunological thing or because of radiation or because of microbiological issue. So inflammation is there. Now inflammation just now started. Okay. Now what should happen, sir? The WBC, it's now marginated. The WBC is now marginated. Now WBCs are going with a very high speed, sir. Very high speed. The WBCs are going with very high speed. So now what we need to do? First we need to decrease the speed of the WBCs. Okay. So do you know what happens now? Sir, on this endothelial cells, dekho, on this endothelial cells, there are these molecules present. Okay, there are these molecules present. So these molecules which I am showing you here, these are called as selectins. Okay, these are like speed breakers, sir. These are like speed breakers. Now, what happens is, this WBC, it is going to bind with them. WBC, on the surface of WBC there is a receptor. That red color thing which I am showing you. So this red color thing is called as silyl Lewis X. It's called as a silyl Lewis X. On the see on this neutrophil I am talking about, this is a neutrophil. Okay, sir, on this neutrophil there is sialyl UV6 present. Now what is this violet color thing? Sir, this violet color thing, they are selectins. Okay, these are the selectins. So selectins are going to bind with the sialyl UV6. Selectins are binding with the sialyl UV6. Okay, so that what happens? Now just they bind and immediately it will detach, sir. Immediately it will detach. This is not a strong bond. It's not a strong bond. So neutrophil is coming, binding and again detaching. Again going to bind with the other selectins. Okay, so what is happening? So we are actually trying to slow down the WBCs which are going through that area. We are slowing down. Okay, we are slowing them down. So how we are actually slowing them down? Because how means with the help of the selectin molecule. Selectins will bind with the sialyl UV6. This helps in rolling of the cells. Rolling. Okay, WBC, it is now slowly rolling. We have decreased the speed. Okay. Now MCQs which will come in your exam is how many types of selectins are there? There are different types of selectins. P-selectin, P-selectin, E-selectin, L-selectin, okay, platelet selectin, endothelial selectin, okay, L-type means leukocyte selectin. There are different types of selectin. What they will ask in your exam is, sir, what is the CD marker, cluster designation, CD marker of the selectins? Any idea, guys? Guys, do you have any idea of the CD marker of the selectins? Any idea? CD 62. Okay, CD 62, guys. Don't forget, this is MCQ. The CD marker of selectins is CD 62. Now what happened? Cells first marginated. Now they are rolling, sir. Now they are slowly rolling. Their speed decreasing. Okay. Now the third event is not CD34. Not CD34. CD34 is a marker of endothelial cells. CD34 is a marker of endothelial cells, not the selectins. Okay. Selectins CD marker is CD62. Okay, CD62. Okay. Now after rolling, next event. Okay, after rolling, the next event is adhesion. Okay, so the next event is adhesion, sir. So what exactly is happening in this adhesion? The name itself is there. Adhesion means tightly bonding. Okay, previously it's just rolling. Rolling means not tight bond. Sialyl UV6 binds with selectin, again detachment. Sialyl UV6 binds with selectin, again detachment. So it's attachment, detachment, attachment, detachment. But now strong bond, sir. Now strong bond is going to form between the neutrophil and endothelial cells. Now let me show you that. So imagine this is your blood vessel. Okay, this is your blood vessel. Here is the area of the inflamed tissue. Okay, inflamed tissue. Now these are the endothelial cells. Now what happens is, look, this is your neutrophil. Okay, this is your neutrophil. Now here, these are different molecules. Now these are the different molecules. Now what is this molecule which I am drawing here? This is VCAM. The green color one which I have drawn here, it is called as VCAM. This green color one is called as VCAM. Okay, so VCAM is present where? On the endothelium. VCAM is present on VCAM for vascular cell adhesion molecule, VCAM. And let me show you with other color, pink color. What is this one? This is called as ICAM. ICAM. So intercellular cell adhesion molecule. Okay, intercellular cell adhesion molecule. VCAM is there, ICAM is there. Okay. Now who is going to bind with them? Sir, on the neutrophil, dekho, on the neutrophil, let me put the neutrophil little above. So let me shift this neutrophil. Okay. So on the surface of the neutrophil, dekho, there are other molecules. There are these other molecules. Do you know what are they? Okay. VCAM, ICAM are present on the endothelium. Dekho, VCAM, ICAM are present on the endothelium. Now, who is present on the neutrophil? Previously, we have discussed about the sialyl UV6. Okay, sialyl UV6 is going to bind with the selectins. Now, right now, this is not rolling. This is tight bondage, adhesion. So, which molecules are going to help in the adhesion? See, now, these black color molecules, do you know anyone? Beta 1, beta 2, integrins. So, these black color molecules are integrins. Okay, so this is beta 1 integrin. Okay, beta 1 integrin. This is beta 2 integrin. So integrins are present where? Sir, integrins are present on the neutrophils. Integrins are present on the neutrophils. Sir, VCAM, ICAM, cell adhesion molecules are present on the endothelial cells. Now they will strongly bind, sir. Now they will strongly bind like this. This is a strong bond. Now there is no more rolling, no more detachment. They are now totally blocked. Blocked. Now, here I want to add important MCQs for your exam. Important MCQs, sir. Dekho, let me draw the same thing with little additional points. Okay. Dekho, this is your blood vessel. What is happening during adhesion? You know it. Sir, what is this? This is one endothelial cell I am showing. This is the endothelial cell. Sir, on the endothelial cell, which molecules are present? Sir, on the endothelial cell, see this is VCAM. Imagine this is the VCAM. Okay, let me show you the green color, same colors. Let me use the same colors. This is VCAM. Okay. Yeah, this is the VCAM molecule, VCAM, vascular cell adhesion molecule, and the other one is pink in color. This is ICAM. Okay, this is ICAM, intercellular cell adhesion molecule. Okay, now they are going to bind with what? They are going to bind with which cell? Here is the neutrophil. Now let me show you the neutrophil here. Let me show you the red color. Now let's imagine this is the neutrophil. Okay, this is the neutrophil, sir. The neutrophil with multilobated nucleus. Okay, imagine this is your neutrophil. Now, sir, you know this is the beta integrin, right? Here I have explained you previously. This is the beta 1 integrin. Let's take, imagine here this is the beta 1 integrin. So which beta 1 integrin, sir? Exactly. Which beta 1 integrin? This beta 1 integrin is VLA4, very light antigen 4, sir. Okay, VLA4, very light antigen 4. See this very light antigen 4, this one, this black color thing, this very light antigen 4, it is nothing but a beta 1 integrin. So VLA4 is binding with what? Sir, VLA4, V for V, okay, V for V, VLA4, very light antigen 4, which is a beta 1 integrin, it is going to bind with vascular cell adhesion molecule. Okay, MCQ, VLA4 is beta 1 integrin. Next, also I have shown one more integrin. So what is this integrin? Beta 2 integrin, right? This is a beta 2 integrin. Okay, beta 2 integrin. Can you give me any examples of this beta 2 integrin? Sir, beta 2 integrin examples are LFA. Okay, LFA. What exactly is LFA? You don't need to know about that. Leukocyte functional antigen, no need to know about that. LFA and MAC. Okay, LFA and MAC. So what exactly are this LFA and MAC? Simple, guys. LFA and MAC molecules, they are nothing but beta 2 integrins. What is an example of beta 1 integrin? The beta 1 integrin is VLA4, very light antigen 4. It is beta 1 integrin. So beta 1 integrins are going to bind with the VCAMs. Beta 2 integrins, that is the LFA and MAC, they are going to bind with the ICAMs. So adhesion completed, strongly bound, adhesion completed, sir. Now after adhesion, what is the next cellular event? Margination completed, rolling completed, and adhesion. Rolling, which molecules are helping you? Sir, which molecules are helping you in the rolling? Selectins, right, with the big letter, selectins. Okay, selectin molecules. And which molecules are helping adhesion? Integrins. Okay, integrins and VCAM, ICAM. Okay, VCAM and ICAM, sir. Okay. Next, after this, what is the next cellular event? Can you tell me? Fourth cellular event after adhesion, sir. Now, see, this neutrophil, where it have to come? We just don't want adhesion. This neutrophil have to come into the area of inflammation. It have to come into the area of inflammation. If there is any bacteria, it have to kill the bacteria. So, now the next step is, any idea? It's called as a transmigration, right? This is a question which was asked in the FMG exams and NEET PG exams also. Transmigration, which is also called as diabetes. Okay, which is also called as diabetes. Okay, diabetes. So transmigration or diabetes. Sir, what exactly is this transmigration or diabetes? Transmigration. Who is migrating? Trans means through the blood vessels. Migration. Who is migrating, sir? Now, MCQ. Dekho, very important MCQ. Again, this is the blood vessel. Okay, here is a blood vessel. Now you know what is this one. So these are the endothelial cells. Okay, these are the endothelial cells. Okay, good. Now this is the area of inflamed tissue. This is the area of inflamed tissue, sir. Okay. Now neutrophil have to come to this inflamed tissue, inflamed area. This is the area of inflammation. Now, देखो what is happening is, sir, here the neutrophil is totally adhesed, sir. Adhesion completed. Okay, adhesion completed. Now this neutrophil, what it have to do? Sir, this neutrophil, it have to actually pass through this gap. Okay, the neutrophil have to actually pass between the endothelial cells. In between the endothelial cells, it have to transmigrate. So this is the endothelial cell. Okay, this is our endothelial cell, which is what it's doing? It's transmigrating. This is called as a diabetes. Now, one MCQ. Okay, one important MCQ is there here. Which molecule is helping in this diabetes? Selectin, integrin, cell adhesion molecule. Which molecule is helping in this diabetes? Any idea? Any idea, guys? Which molecule is helping in this diabetes? Come on, Rini, fun mode. Come on, Rini. Any idea? Which molecule is helping in this diabetes? This molecule is called as PCAM. Okay, let me write. Yeah. So the molecule which is helping, which is present on the endothelial cells as well as on the neutrophils, this molecule is called as PECAM. Okay, PECAM, sir. Okay, PECAM, which is also called as CD31. MCQ. This is the MCQ. PECAM or CD31 is the molecule which is going to help you in transmigration. Okay, done. Transmigration also completed. Now after transmigration, what should happen? After transmigration, sir, now where is a neutrophil? Now neutrophil came into the tissue. Now neutrophil, it came out of the blood vessel. First it came out of the blood vessel. Now here is a neutrophil, sir. It came out. Okay, neutrophil came out of the blood vessel. Okay, this is a neutrophil which came out. Now, see here, the next event I am telling you, actually this is not a cellular event, this is not a cellular event, but I would like to tell you here itself. Okay, now dekho, sir, here in this inflamed area, maybe in this condition, this inflammation, this injury, this damage is because of microbiological insult, because of some bacteria is causing inflammation, sir. Now here, now what we need to do with the bacteria? We have to kill the bacteria. Okay, we have to do what? We have to kill the bacteria. So how can we kill the bacteria? By garnishing this bacteria. You need to garnish this bacteria. You need to make it beautiful so that immediately the macrophage or the neutrophil will recognize it and it will eat it. Okay. So the next event I am discussing here is called as opsonization. Okay. Yeah, I will come to the chemotaxis. But before chemotaxis itself, I am telling you one small event. Okay. So that is opsonization. So what is opsonization? Opsonization means you need to know, if this is the bacteria. Okay, this is the bacteria, sir. Okay, bad guy. Now what we need to do? We need to decorate this bacteria with the help of certain molecules. Those molecules are called as opsonins. Okay, so opsonins, what are those molecules which will help in fast killing of this bacteria? Okay, so those molecules are, right, leukotriene before, yes, exactly, fun mode, coating this bacteria so that this bacteria will be easily destroyed. Okay, so leukotriene before, interleukin 8 and C5a. Okay, so leukotriene before, interleukin 8 and C5a, what are they? So these are opsonins. Now you are just coating this bacteria. Okay, you are just coating this bacteria so that now easily the neutrophil will recognize this bacteria and will kill the bacteria. Okay, so what they will ask in your exam is, which of the following molecules are opsonins? LT4, interleukin 8 and C5a. These molecules are called as sorry. Just one small mistake I made. Sir, these are not the opsonins, these are the chemotactic agents. Just 1 minute, one small change from my side. So what are the options? Options are C3b, C3b and FC portion. Okay, FC portion of IgG antibody. Okay, FC portion of IgG antibody. Okay, so these are, sir, this is C3b. Okay, complement protein C3b. Okay, C3b and Ig, yes. Okay, so C3b is the decorating molecule. So making the bacteria more delicious for what? For phagocytosis. Okay, so just this one point remember. Now let's come back to our topic. Transmigration completed, sir. Transmigration. The WBC came into the tissues. The WBC came out of the blood vessel. Now what should happen? Sir, this WBC, it have to go, or the neutrophil have to go to the area of inflammation. It have to go to the area of inflammation. So now draw this. This stage is called as chemotaxis. The fifth event is called as chemotaxis. What are the first 4 events which we have completed? First 4 events are migration, rolling, adhesion, transmigration, and now chemotaxis. What exactly is chemotaxis? Right? This is a blood vessel. Neutrophil came out of the blood vessel. Okay, neutrophil, it came out of the blood vessel, sir. Now what it have to go? Where it have to go? See, this is the area of inflammation. Okay, this is the area of inflammation. Now it have to come to the area of inflammation. Directly it have to come to the area of inflammation. And what it have to do? It have to attack the bacteria. It have to attack the bacteria, sir. Bacteria is already ready. It is ready, garnished. Garnished with what? C3b and FC portion of IgG antibody, FC portion of the IgG antibody, C3b, and even molecules like fibrinogen. Even molecules like fibrinogen acts as absorbents. Okay, acts as absorbents. Now this movement, my question to you, this movement, the movement of this neutrophil directly to the area of inflammation. It's a unidirectional movement. See, it's not a multi-directional movement. It's a one single. It's a unidirectional movement, sir. This unidirectional movement is called as chemotaxis. Unidirectional, sir. It's a unidirectional. Okay, they will ask you, chemotaxis is unidirectional or multidirectional? It's a one single. Directly it will come. The neutrophil won't go here and there. Neutrophil will directly come to the area of inflammation. Why? Sir, how this neutrophil, the neutrophil is not having eyes, right? Then how it will know where it should go? So how it will know that where it should go? Where it will directly come to the area of inflammation. How, sir? Because from this area, from this inflamed area, okay, from the area of inflammation, certain chemicals are released. Certain chemotactic agents are released. So now this neutrophil will sniff. The neutrophil is going to sniff these chemicals and directly will go into the area of inflammation. So what are these chemical mediators? These chemical mediators are called as chemotactic agents. Okay, let me write here what are the chemotactic agents. Chemotactic agents. So what are these chemotactic agents? Previously I have written, right, the leukotriene B4, interleukin 8, okay, and C5a. So these are the chemotactic agents. See, these chemicals are produced from the area of inflammation, so that neutrophil will identify from where these chemicals are coming. Okay, so neutrophil or macrophages will go to that particular area. So chemotaxis also completed. Now just tell me important points about the chemotaxis. Chemotaxis is the movement of the neutrophil to the area of inflammation. Chemotaxis is unidirectional or multidirectional? It's a unidirectional. Which chemicals helps in this chemotaxis? What are the chemotactic agents? The chemotactic agents are leukotriene B4, interleukin 8 and C5a. The chemotaxis also completed, sir. Okay, cellular event, chemotaxis also completed. So what we have completed? Which cellular events? Margination completed, rolling, adhesion, transmigration and chemotaxis. Okay, chemotaxis also completed. Now last one is what? Okay, see, dekho, the last one is phagocytosis. Phagocytosis. The last event is phagocytosis. So what exactly is phagocytosis? Now, so guys, this is the area of inflammation. Now, for example, see, this is the area of inflammation, sir. Okay. Imagine this is the area of inflammation. Now, here is the bacteria. Imagine, sir, this is the bacteria. Okay, there is this bacteria present here. Oh, no, why like that? Now, let's see. This is the bacteria, sir, bad guy. Okay, here he is, bad guy. Now our neutrophil also came here. Okay, now our neutrophil also came here. Now here, dekho, this is our neutrophil. Many neutrophils will come into this area, sir. Okay, neutrophil via the chemotactic agents, via the chemotaxis, it came into the area of inflammation. Now, do you know what this neutrophil will do, or this macrophage, whatever came, it will do, sir? Now, dekho, sir. Now this neutrophil, it is extending its cell membrane. Okay, this is one neutrophil, sir. Okay, this is our neutrophil. What it is doing? It is extending its cell membrane. So it's forming this arm-like structures. These are called as pseudopods. Okay, these are the pseudopods. By forming its pseudopods, now it is doing what? It is engulfing. It is engulfing the bacteria. Okay, it's taking the bacteria. Okay, so these are the pseudopods. Pseudopods. So with the help of the pseudopods, it will engulf the bacteria. It will take the bacteria into the cell. So now I should show you something like this. Imagine this is the neutrophil. Inside the neutrophil, you got a vesicle. You formed a vesicle. You have taken this vesicle into the cell. Now in the vesicle, who is there? This poor bacteria is there. See, dekho. This is the poor bacteria which is now crying because it's going to be killed, sir. It's crying. Okay. So now this vesicle is called as, now the bacteria is taken into the neutrophil. Now this vesicle is called as phagosome. Phagosome, sir. Okay. Now the phagosome came into the cell. Now what will happen? Do you know? Now what will happen? So we have to kill this bacteria. How can we kill this bacteria? Guys, do you know how can we kill this bacteria? One more Reen. Do you know how we can kill this bacteria? Sir, inside this neutrophils and macrophages, inside our WBC, what do we have? We have something special. Sir, what is this, sir? This is lysosome. There is lysosome, sir. Okay, there is lysosome. What we have to do? We have to fuse this lysosome and phagosome. Okay, so do you know what happens now? Dekho, the next event is, sir, this is your WBC, neutrophil or the macrophage. Now, inside, what is this? Sir, this is the, dekho, look at here. So, this is your phagosome. Inside the phagosome, who is there? Bacteria is there. This is the bacteria. Okay, this is the bacteria. Okay, now this phagosome, it's going to be fused with what? It is going to be fused with the lysosome. Okay, both the phagosome and lysosome, they are going to be fused, forming what? Phagolysosome. Okay, now this is phagolysosome. Now what happens? Now the hydrolytic enzymes, whatever were there. Okay, now the hydrolytic enzymes, whatever were there in the lysosome. Okay, the hydrolytic enzymes, okay, whatever were there in the lysosomes, they will be releasing onto the bacteria. Now, tell me what happens. Sir, do you think the bacteria will be survived now? No, sir. The bacteria is not going to survive. Okay, the bacteria is not going to survive. The bacteria will be killed, sir. The bacteria will be killed because of this hydrolytic enzymes. Okay, because of this hydrolytic enzymes, the bacteria will be killed. Okay. So, bacteria, dead, sir. Here I want to add one important point. Actually, when phagosome and lysosome, when they fuse, what actually happens is you are killing the bacteria. But there are two types of killings, sir. Normally, there are two types of killings. First, let me tell you, simple. Look, this is your WBC. Okay, neutrophil. Inside the neutrophil, now what is this? The phagosome. Now it is going to be fused with the, so this is the phagosome. Let me draw. This is the phagosome. It is fused with lysosome. Phagosome is fused with the lysosome, sir. Okay, phagosome is fused with the, yes, Rini, you are true. Phagosome is fused with the lysosome. Now, do you know what happens? What happens is, now, phagolysosome is formed, sir. Here is our bacteria, dekho. Here is our bacteria. Okay, the poor bacteria. Literally crying, sir. Okay, please leave me, it's crying. Okay. Now, this guy. Now, do you know what happens? Now, these neutrophils, these cells, they will take the oxygen. Okay, they will take the oxygen. Oxygen is something good, right? They will take this oxygen. Now, these oxygen molecules, they are converted into free radicals. Okay, with the help of an enzyme. The oxygen, they will take. This is something called as oxygen dependent killing. During oxygen dependent killing, the powerful way of killing the bacteria. Okay, what happens? Oxygen molecules were taken. They are converted into these free radicals. Okay, they are converted into free radicals with the help of an enzyme called as NADPH oxidase. With the help of an enzyme called as NADPH oxidase, the oxygen is converted into O2 minus. Okay, O2 minus. Now, this O2 minus, with the help of one more enzyme which is called as superoxide dismutase. With the help of this superoxide dismutase, these oxygen free radicals, the superoxide ions are converted into H2O2. Okay, H2O2, hydrogen peroxide. But this hydrogen peroxide is also not a great chemical, sir. It's not a, yes, of course, it's a free radical, but it's not a powerful thing. Now this H2O2 will be converted with the help of an enzyme. There is an enzyme called as myeloperoxidase. Okay, with the help of myeloperoxidase inside the lysosomes. Now, what happens? Do you know the one chloride molecule is added onto this H2O2. Now, what do you form, sir? At the end of the day, HOCl, hypochlorous acid. Now, hypochlorous acid is getting formed. Okay, so oxygen is converted into superoxide ion. Superoxide ion with the help of superoxide dismutase is converted into H2O2. This hydrogen peroxide with the help of enzyme myeloperoxidase is going to convert it into hypochlorous acid. Sir, this is the most powerful chemical in your body. It's bleach, sir, bleach. It's the most powerful free radical. Now, do you know what it will do? It will come without any mercy. It will kill the bacteria, sir. Okay, it will kill the bacteria. So, bacteria is dead. This is something called as oxygen dependent killing. Okay, by using the oxygen, you kill the bacteria. Okay, so what is formed? Which free radical is formed at the end? Hypochlorous acid, HOCl, the most powerful free radical. Okay, one integration here, okay, which you need to know for your exam. So the first step in the oxygen dependent killing, what is the first step? Conversion of oxygen to free radical, that's a O2 minus, superoxide ion. See, this step is mediated by what? NADPH oxidase. This step is called as respiratory burst or oxygen burst. Okay, oxygen burst. Now, if there is a deficiency of this enzyme, NADPH oxidase deficiency. If you have deficiency of this enzyme, okay, NADPH oxidase deficiency, it's not there. Can you tell me which disease will occur? Sir, NADPH oxidase is not there. No superoxide ion. Without superoxide ion, no H2O2, no HOCl. No, this bacteria cannot be killed. The bacteria will not be killed, sir. It will cause recurrent infections in the person. The bacteria are not being destroyed. So can you tell me what is this condition called as? Deficiency of NADPH oxidase. This respiratory burst, first reaction is not happening. It will cause which disease, sir? C. Panmode, Reen, Kashyap. Are you guys there? Panmode, can you tell me what is this step? What is this disease called as? CGD. CGD stands for chronic granulomatous disease. Chronic granulomatous disease, it is due to deficiency of NADPH oxidase. If that NADPH oxidase is not there, that will cause chronic granulomatous disease. Okay. So with this, we have killed the bacteria. Bacteria is dead, sir. So what we have seen in this total lecture, we have seen acute inflammation. In the acute inflammation, what happens? First, there are certain vascular changes. Vasoconstriction, vasodilation, increased vascular permeability and stasis. Vascular events. After the vascular events, cellular events will start. Margination, rolling, adhesion, transmigration, chemotaxis and phagocytosis. With phagocytosis, the bacteria is dead. So cellular events also completed. Important things are selectins are helping in rolling. Integrins and VCAM, ICAM are helping in adhesion. PCAM or CD31 is helping in what? It is helping in transmigration. Which molecules are helping in chemotaxis? LTB4, C5A and LTB4, C5A molecule and interleukin 8. Which molecules are helping in opsonization, decorating the bacteria so that it will be easy for the neutrophil to consume? It is C3b as well as Fc portion of IgG antibody. So with this, we have completed the acute inflammation. Okay, vascular events and cellular events are completed. In the next class number 4, we'll be discussing the chronic inflammation. Okay, important topics about the chronic inflammation, a wound healing, granulomas, and some important cases, at least 15 cases which came in the topic of inflammation will be discussed in the next class. Okay, is it okay? One more. Okay guys, this will be enough for today. See you in the next class. The PDF will be shared in the Telegram group. Thank you. Good night.